Hello everyone. This presentation is on Tang, also called for substance decoction with safflower and peach pit. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Tang belongs to the category invigorate blood. A representative pattern is blood stasis with blood deficiency, fixed pain, dark complexion, or dysmenorrhea. Important ingredients include tauren, honghua, dangui, chuangshen, baishao, shudaihuang. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 43-year-old woman with painful menses and blood stasis signs. The current medicines are warfarin, aspirin 81 mg, metformin. This case gives a possible reason to consider Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is tauren/honghua/dangui/chuangshen plus warfarin or aspirin. The mechanism is that this is a major blood invigorating combination, and bleeding risk can increase meaningfully with anticoagulants or antiplatelets. The clinical significance is potentially high. My management plan is generally avoid unless the prescribing physician specifically agrees and monitoring is close. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is shudaihuang plus metformin. The mechanism is that rhythmania may contribute mild glucose lowering. The clinical significance is low to moderate. My management plan is monitor glucose. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is heavy menses context. The mechanism is that the clinical pattern may involve bleeding symptoms already, making drug-herb risk more important. The clinical significance is clinically significant. My management plan is do not self-treat heavy bleeding without medical assessment. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Tang may be reasonable when the patient truly matches the pattern blood stasis with blood deficiency, fixed pain, dark complexion, or dysmenorrhea. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.